Essential Therapy followers. This is a new one. This is a first tonight. I am joining with Dee, who is a patient of mine, and she is eager to share her story. And I'm just so grateful that you are, Dee. And we're trying something new. So this is going to be a series of stories of healing because
Mhm.
we know that you are on this incredible healing journey, and I'm so glad that we've met. So, I'm going to give you just a few minutes to share your story. I think, I should have had the dates down here because you know how time flies so much. But do you remember when you and I met? Has it been like 3 months, 2 months? 3 months.
It's probably been about 3 months, yeah, for
About three
sure.
months. Yeah.
Mm.
So, I when I heard about your story, I couldn't wait to meet you because I knew that this work that I do could really be helpful for you. Give us a little background, kind of the short story of where you've been.
Well, about 5 years ago, I ended up with a pretty severe, bowel blockage, which, ended me with some pretty traumatic surgeries over and over again in my abdomen area where they cut into the muscle, and there's lots of scar tissue, both directions, stem to stern. I am cut, you know, and then during the healing process, you're in a recliner bent over because you don't want to stretch the stitches at all. So basically, that messed up my mobility a lot. It really restricted my movement. And the more I restricted it, the more pain I got till I could barely move.
So, about how long do you suppose you were laid up?
Gosh, it was a couple of years, off and on because the severe cramps and the traumatic healing process and colostomy bag and all of that, and then an unsuccessful takedown. Yeah, it was a long, long time. Many nights not sleeping. Going from being used to working out every single day to not being able to move hardly at all.
Wow. So, eh, total surgeries on just your abdomen alone. Do you know how many you had?
If you count the repaired hernia,
Wow,
five
that's a lot of
surgeries.
surgeries for sure. And of
Yeah.
course, we know every time we have that invasive procedure, there's more scar tissue being created. And the scar tissue is what causes the problem and probably what caused your bowel obstruction. So let's back that up a little bit. Did you have any surgeries before that? Let's talk a little bit about your back.
Yeah, I had cages put in at L5S1 where a fully blown disc, and then that broke about 3 months after they put it in, and they had to go back in and put in cages to stabilize it. So there was severe nerve damage on the right sciatica, which is
Yeah.
where a lot of my pain is right now, for sure.
And so 5 years ago was the bowel obstruction surgeries. How
Mhm.
long before that, or how many years ago was the back surgery and the failure of that?
That was in the first surgeries were in 2004, June and
Okay.
then December of that year. Yeah.
Okay. So we're talking like 15 years, 16 years, and then you had this bowel obstruction. So that surgery, that first surgery, did you have that as a posterior where they came in through the back to repair that, or did they go through the belly?
They actually went through the back on that one.
Okay.
Yeah.
Okay. So was there any explanation or did anyone have any idea why you ended up with these bowel obstructions that resulted in these five subsequent surgeries?
No, they give me no explanation, and I was really disappointed that they didn't analyze the blockage better so that I could prevent it in the future. But they did
Mhm.
tell me that I am highly, highly susceptible to scarring. When they went in the second and third time, it took them a couple of hours just to get through the scarring to get to where they needed to go. So,
Okay. So then fast forward, I saw you about 3 months ago when we first did some hands-on work. And do you recall how that was for you, just briefly, so people can hear that.
I was amazed because we had minutes well hands on. And the next day, I just noticed such a marked difference. I just thought, I know this is it. This is going to help me. This
Mhm.
is going to work. You know, I was really excited to move forward and get more for sure.
Yeah. And I remember we did a lot of patient education that day. We talked about self-treatment because I knew that, I didn't know how often we were gonna be able to see each other. Wanted to make sure you were headed in the right direction with that, and we did a lot of, gentle technique over your abdomen, what I refer to as visceral work, using the John F. Barnes Myofascial Release Approach, which, of course, we're never forcing the tissue. We're connecting with your body and feeling and following the body and allowing your body to heal on its own essentially, and setting up an environment for it to do that. You had a lot of hardness in your belly, and when we relieved that just for that short time, that first time, you felt a lot of relief. And then I do remember you doing some legs up the wall eventually, and you want to give me just a little update on what that was like for you and also what you've been doing.
Well, yeah, the legs up the wall right now is what gives me the most relief.
Hmm.
Especially if you really, really relax and just uh, find a quiet time, a quiet space with the legs up the wall and really just focus on yourself and your breathing.
Hmm.
That does it for me instead of trying so hard to fix it, just
Right.
relaxing
I
helps the
remember us
most.
I remember us talking about the calm technique, the connect, assess, listen, and move, and we use this app called Marco Polo, everyone. If you don't know what Marco Polo is, it's this amazing tool. I love using it with Dee because she can just pop on there and give me a video message. So it's like text messaging, only it's video. So I get to hear her expression and see her face and kind of really experience it. And she's getting the same back from me, and I'll never forget when you sent me that video and you said, I think I know what you mean now with this calm technique. I really settled in and I could really tell the difference. So great job. And when you do that, you've mentioned that several times that that makes a big difference for you. So that's really great.
Yeah,
So
I've always made the mistake of trying too hard. Just push, push, push. Make
right.
it better instead of relaxing and
Mhm.
just letting it happen on its own.
So you've had a lot of pain in that right leg, similar to the sciatic pain you had years ago. There's a lot of tension there, and when we're looking at your body, you were really scrunched. In fact, it's funny. I'm going to show this little fascia man picture because you looked like this, if I recall. And
Yeah.
we had you lay over a pillow to kind of open up this right side of restriction, and it was kind of funny because you looked very much like this, and your right leg was short. We corrected that, well, pretty easily that first time, I believe, and it's just been a consistent. You've been very consistent, which is great in your self treatment and with the legs up the wall in all the positions. I believe I first gave you the first position, and then we added those, and you've worked with those, and they've been okay during all this time. Is that right?
Yeah, I think there's one that I've seen on your film that I haven't tried yet, but, yeah,
Mhm.
most of them I'm doing now.
So what we noticed and what I wanted to talk about today is that even during this whole time, you've had moments where you felt really, really good, and then things start to slip. You start to get your symptoms back. So it's like that subconscious holding pattern in your tissue starts to return, or something's going on, and you start to get your symptoms, and it starts to really bring you down because it's like, oh, here's this pain again, and what's going to happen. But you've had enough up times that we were talking about how you really wanted to get back to movement and walking and maybe even running, and I'm like, absolutely, you can do that. And you're like, really? Yes. And so you signed up for your first 5K, and you did that 2.5 weeks ago, so
Mhm.
congratulations.
Thank you.
How did you feel about doing that for the first time?
I was elated that I was able to get to do that. Um, there was a time when I really didn't think I would ever run again, and, I'm looking forward to the next one. I really want to, work towards that and get a better time. And what I didn't realize though was the ups and downs that were gonna come. I thought it was gonna be just a gradual uphill climb, but there are downs where you're worried that it's gonna go back to the way it was, and, you just have to really focus on the positive things that you notice going on, because there are still a lot of positive things going on even when the pain starts to come back.
Mhm. And so the reason why I wanted to have this meeting was I heard you earlier today feel talk about feeling one of those downs and
Mhm.
and starting to get pulled into this state of oh no and all of that. Let's talk about that a little bit.
Yeah, because like I said this morning, I thought, "Man, if I had to do a 5K today, I don't know if I'd get all the way through it."
Hmm.
I'm worried I wouldn't even be able to make it the way I feel right now. But then
Hmm.
I realized, I'm still a work in progress and I still feel better. I still have more energy. I've lost some weight and my overall health is improving
Hmm.
gradually.
Right.
So I
and
know
you
it's still working.
And you've made some other changes in your life too. I think it's noteworthy to bring that up because it's super important to note that not only have you've only got a little bit of myofascial treatment. I think we've worked together 3 or 4 times, hands on over a
Mhm,
long period of time. It just schedules and that sort of thing. So you've done the self treatment, which is great. So really, the fact that you've improved this much with not a lot of hands on that I would have preferred to have for you, but you're still going in that direction. I feel like it's a lot of your mindset, your consistency with the self-treatment. You've also
mhm.
consistently been getting on the treadmill, even if you feel like I'm not quite sure what I can do. So that's been great. But tell us a little bit about diet and how that's changed for you.
My biggest thing is I noticed that sugar really causes a lot of inflammation in my body. It's a direct cause and effect. If I have like a bowl of cereal, the next day everything is inflamed, and I wake up feeling like I was in a car wreck, just really sore and swollen everywhere.
Hmm.
And I thought, oh my gosh, it's the sugar. I was surprised, I know it's not good for you, but I thought I didn't know it was literally, inflaming every joint in my body.
Right. And I remember when we had the first conversation about that, and kind of, as I was inquiring about dietary things and just my background and history in my own body, like I know if I have sugar or even too many carbs, what that does to my sensations in my body, soreness and inflammation and all the things. But I do remember the first time you had gone several days with like a very low carb diet, which was great and really cut out the processed stuff. And then I think it was probably just maybe some comfort food moment. You wanted to have and you had some
Yeah.
cereal. And the next morning
Mhm.
you were a train wreck just from that. So it was really great for you to see that, which I think is good. I think we need to do these trial and error things and see what it's actually doing to our bodies. I remember the first time, I mean, it was decades ago when I first was doing a lot of this for myself and getting that aha moment of having sugar and noticing within 15 minutes that I could feel it. And it
Mhm.
was not a good thing. So, you would think that I would never have it again, but that's not the case. I mean, you still find myself having things and reminding myself, oh yeah, that's why I don't want to make that a habit. Um, so since you've been having some more pain recently, I know I need to work on you again. We've got that planned in the next couple of days. How has your diet been over the last week?
I've definitely done a lot better.
Mhm.
I've gone probably a week and a half, almost 2 weeks without sugar, and if you know me, that's a miracle. That's
Mhm. Well, good job on that. Yeah, good. Mhm. So, aside from sugar, because when we talk about sugar, we're usually talking about like candies and added sugar, that kind of a thing, right? What about the content of food that you're having for your meals? Like, are you having what types of foods?
well, if there is something that I want that's sweet, I go for fruit.
Mhm.
I'll have an apple, and even that sometimes is a little too much sugar. But I do like to eat cottage cheese. I have a fat-free cottage cheese that I like. Um, and I usually just eat some sort of meat for dinner. I don't try to have pasta or because anything that has a lot of carbs seems to break down into sugar pretty quickly.
Yep.
So,
Yep, it does. Okay. So, and we'll be talking more about diet as we continue to work together for sure.
mhm,
But let's talk a little bit also about where your thoughts were going this morning when you left me that Marco and you were just kind of going down this spiral of oh no kind of thing. You want to
mhm.
share a little bit about that?
Yeah, I was really worried because, like I said before, I thought I was just gonna gradually get better and better and better, and just keep building and running faster and running longer. And there are times when I can just barely get 20 minutes of walk and I can't do anymore. So I
Mhm.
was really disappointed in that. I thought I so want to run again. When once you've been a runner once, you really feel like a trapped animal when you can't anymore.
Mhm.
It's
Mhm.
kind of an addiction that you get. I wasn't a marathon runner by any means, but when you're used to running 3, 4 miles a day and you really enjoy it, it really, really is affects your everyday life when you can't.
Well, it
It,
sounds like it was
yeah,
a stress reliever for you as well. It was one of your tools for relieving stress.
absolutely, yeah. It was something I did for myself. It felt good. I was by myself. I never did
Yeah.
it with anybody else because I like that time to myself
Yeah.
for sure.
And I can relate to that the whole thing of running, and years ago when I then wasn't able to run, it was just like it crushed me because that
Mm,
was such a huge tool. So I definitely can relate to that. And I want to share something with you that I think is really very important. A few things actually. First of all, let me remind you that healing is not linear. Okay, this comes from John Barnes, my mentor in myofascial release. And what do I mean by that? It's not that straight line. You're going to continue to get better, like you've already commented on. We are all over the place. I mean, life changes by the moment,
mm,
depending on what we eat, depending on what we're thinking and what we're feeling and what we're exposed to every day and all of those things make a huge difference. Even with getting treatment, a lot of times even this gentle work can create what's called therapeutic pain. And that therapeutic pain is part of healing, and even though it's uncomfortable, it still is part of that process. So
mhm,
I think I remember in my healing journey many years ago when I finally got that concept and I started to really trust the work and not just the myofascial work, but just this whole process of healing in general and being present in my body and realizing that it can change quickly and it can also sometimes take time to change. But what I noticed is that it really mattered what I was thinking, and what I was thinking created what I was feeling. And then when I had my first intensive treatment, I had been not feeling very well for about a year and a half. Had not been able to run for that entire time. Even was having problems with just general working out. I was having severe migraine headaches, body aches and pains. I was taking prescription medications most days of the month that you really wouldn't want to be taking. And
mhm,
I didn't think I'd ever run again either. And it was, I just didn't know what was, what, and nothing was being found on any kind of testing. There was nothing to really, I just didn't know what to do. So
mhm,
when I went and got intensive treatment at the Barnes Clinic in Sedona, John said to me, it was toward the end of the week, he said, "What is it that you'd like to be able to do?" And I no one ever asked me that before. And when I asked you, you'd like, I want to be able to run. And that's when we came up with the 5K idea, right? And when
mhm,
he said that, I thought about it and I thought, gosh, if I could even do a mini triathlon. Back then I was doing the longer ones. But if I could do even a mini one, then I'd be able to do all the other things that I want to do, including work without pain. Like that would be
mhm,
amazing. And he said to me, I want you to start imagining that you're doing that you're able to do, like, see yourself, feel yourself, imagine yourself doing that, doing an event, and use as many senses as you can in that visualization. Doesn't matter how long it is, it could be just even a few seconds, but do it several times a day and do it every day. And
Mhm.
he, I had heard this concept before, but hearing it from him and telling me directly in that situation that I was in really, really stuck for me. And what I thought was, okay, I'm going to really start doing that. And it was at the end of February at that time. Went home after my intensive, started really doing that and also doing the work. I got some more treatment over the next several weeks. I went to other classes. Actually, there was nobody here to do that kind of work back at the time. And I was doing self treatment. And in June, I was able to do my next triathlon again, which is amazing. So,
Mhm.
March, April, May, and June, less than 4 months later, there I was. And I know for certain that it was my thoughts of visualizing that and believing and not worrying about how it was going to come about, but just trusting the process and trusting the journey. And what happened was that helped me feel better. If I would just imagine that and not worry about the details, I started to feel lighter and happier and more hopeful. And that brought me up that scale. We've talked about this emotional guidance scale before, which I don't have a picture of it here right now, but it would bring me from that feeling of hopelessness where I know, Dee, you have been in that feeling of hopelessness often
Yeah.
over these 5 years. It
Mhm.
brought me up from hopelessness, and sometimes I would feel frustration, sometimes I would be angry, but even that was better than and higher up on that frequency scale than feeling hopeless, right?
Mhm.
Until I was
Yeah.
able to start to feel hopeful instead of hopeless. And when I would imagine that happening and know that there were other people who had experienced this type of healing, then I started to really feel that shift. And that's what I wanted to talk with you about today and I just am going to walk you through a little guided imagery actually. So I want you to just kind of just close your eyes and just
Mhm.
imagine. So you can remember it wasn't that long ago that you did this little 5K that we just did.
Mhm.
So you kind of know what it's like to run through that finish line or hobble, if you will, or maybe not feel perfect while you're doing it, but you can see and hear the people there. And I want you to imagine what it would feel like to go through that whole 5K, running, maybe stopping at a water break, okay, seeing some of the people around you, maybe feeling what's the temperature like? What are you wearing? What do you see? Is the sun shining? And see the people around you, hear the laughter, hear people talking, maybe hearing the footsteps going. And while you're doing that, think back to those really difficult days that you had 5 years ago and how you never thought you'd be doing this, and let yourself feel the joy of being able to be out there on those streets with all these people. People with so many stories. They have so many stories about where they've been and how they got there. And you have your unique, incredible healing story. And
Yeah.
feel that lightness in your heart, like really connect to that in your heart. Feel the smile on your face. See yourself move. Look at that. I can see your smile. It's beautiful. And even for that little moment that here we are thinking this, feel that how that elevates you. Do you feel
Yeah.
that?
Yes, I
Yeah.
do.
Yeah. So if you do that often through the day, don't wait until you're having a down moment. Just make it a habit. Like
Mhm.
often. You know, I would do it all through my day. Sometimes I would be treating patients and I'd take just a moment and I'd think about that. Or I'd be in the car and the traffic light. Every time I would hit a traffic light, I would take that time to visualize and feel that. And I
Mhm.
really truly believe that made a difference in my healing. So I love how right there I could see that you felt better at that moment. You know
Yeah.
what that's going to do? It's going to take you forward. So the rest of the day, what are you going to do? You're going to make better choices. You're not going to feel, you know, I guess the word would be tempted if you're at work and somebody brings in donuts, right? Or they've got
Yeah.
leftover Halloween candy they're trying to get rid of or whatever it is, right? You
Mhm.
have you're practicing all throughout the day to solidify that goal for yourself.
Mhm.
And knowing and feeling that in your body first, the body follows the mind. So you're creating that moment and you're creating that sensation as if it's already happened, as if you're already there and little bits of time and then you're throwing it out into the universe and and your body, your tissues, your cells are going to follow that because your cells don't know. If we can create an environment first with our thoughts and in our mind and in our heart, it helps our physical body to follow.
Mhm.
So I think you've practiced that a little bit,
Yeah.
but yeah, do you notice how it falls off and then it makes it more difficult for you? Have you seen that correlation yet?
Oh, definitely. Yeah.
Mhm.
I need it's like meditation for me. It's something I need to practice to get better at. So,
Absolutely, absolutely, and you can, and I will continue to help you. When you start to feel that down, you just marco me, and then I'll throw you something back. It seems like that's helpful for you, right?
yes, it is very.
So let's talk just a little bit about the self treatment that you're doing. So that's the first thing I need to do is start with the mind, right? So set yourself up in a positive space for that because you can do that anywhere. And then when we're talking about the self treatment, what I would like you to do is I think at some point we've tried having you lay on your belly as well when you start to have that pain in
Mhm.
your leg. And then have you done any self treatment with the small ball on your belly yet? I can't remember if we've done that.
No, no, I haven't done that yet.
Yeah, I think it was a little too much at the beginning, and it might be now because I need to see you again. So I'm not going to have you start that. Other than just give yourself an opportunity to lay on your belly, just rest your forehead on your hands like this, and just being in that position helps to pull and kind of take up the slack in your abdomen. Because remember, the back and the buttock, okay, this whole front of our body is the front of the back. And so
Mhm.
this tightness here, like you even mentioned after your surgery, you were all curled up. And I've
Mhm.
done a lot of work on your belly. That's where you have so much of your restriction. So if we can open that area, and one way that you can do that is to just lay on your belly for a few minutes on the floor. Maybe if you can work up to 10-15 minutes, that's going to give a nice gentle elongation in that area. If you can stay in that place for at least 5 minutes, the collagen and the myofascial restriction is going to start to adapt to that new
Mhm.
position, and it might actually help relieve some of that pain. So between
Okay.
now and the next couple of days, like I see you in 3 days, try that. Let me know
Okay.
how that goes for you, and
Okay.
if it's not helping, we will try something else. And
Okay.
then really good job with your diet. Just really stay away from the carbs. Like that's one thing I really notice is that if I can really cut that down and make sure you're getting enough fat. I noticed that you mentioned fat-free cottage cheese. It's
Mhm.
actually really hard to find cottage cheese that isn't fat-free, I've noticed. But let me remind you that every single cell of our body is wrapped in a lipid bilayer, meaning it's covered in fat. We need fat. We need way more fat than what we've been told for the last 50 years. So
Mhm.
most people are not eating enough fat. Animal fat is best. So fatty beef is good to have. I mean, don't shy away from fat in your food, especially the good naturally occurring fat. We don't want trans fats and all of that junk and seed oils and that kind of thing, but healthy and animal fats are good. Also, the coconut oil, olive oil, avocado oil are
Mhm.
good also. But make sure you're getting enough of that and plenty of water. And especially when you're feeling like you have a lot of inflammation. And I notice for myself, if I do that, sometimes I'll even fast. I'll do a intermittent fasting, or I'll even go a couple of days, which I don't want you starting any of that until we can talk further about it. But if you can stay away from those inflammatory foods, it will help you a ton when you're
Okay.
having a flare up. So, okay.
Yep.
All right. Do you have any questions or thoughts or comments for me?
No, not at the moment.
Okay. Okay. Well, I'm looking forward to seeing you on the weekend, and maybe we can even record there a little bit. I know we did that little short recently where I was doing that transverse plane on your abdomen, where so much of your tightness and pain is coming from. I cannot
Mhm.
wait to get my hands on you.
Me too.
Okay,
All right.
awesome. Well, I think that's all I have, and we're looking forward to sharing Dee's journey with all of you. And we really are in the beginning. Even though I've known you for 3 months, we haven't really started buckling down because there's a lot of stuff going on with essential therapies right now. But we're at a space now where we're going to get you some little mini intensive time going on, and we've got, I think your next 5K is Thanksgiving, and it's
Yep.
the 29th, so it's actually just about a month away because I know
Mhm.
Thanksgiving is late this year. And yeah, keep visualizing. I'll visualize with you, and it's going to be a good ride.
Thank you.
All
I'm looking
right.
forward to it.
Me too. We'll see you soon.
Okay. Bye.
Bye.